Good evening, students. Today we are going to discuss about one topic, which is health performance management in public health. Like we all know, what is the meaning of health performance management? What they do? They always try to evaluate the performance of the health worker who is delivering the health services in the public. And second reason for health performance management in public health is to improve the population health. As we all know that we have different types of services in health system is providing us health treatment. For example, maternal and child welfare, environmental safety, family planning, immunization, oral health, etc. etc. So like we have different types of department who is providing health services to the people, to the public. And now the question is how health management can analyze the performance. In that case, we have three ways to evaluate, through which they evaluate the performance of the health workers. The one is the core function. Second is the essential services in public health. And third is the healthy people 2000. These are the three platforms through which health performance management can do the performance. They can analyze the performance of the health workers. So let's start about these three pillars. The one is the core function. What is the core function? Core function divided it into three parts. Core functions. The first is assessment. What we do in the assessment? In the assessment, we as a health worker or a health system, they always analyze the health issue in the society, in the community. Community needs we will do in the assessment. Second is the policy development. Policymaker or health policymaker or the government, they developed a policy on the basis of the community health need, which we do in the assessment. So that's why assessment linked with the policy development. And third, we have assurance. What we do in assurance? We do assessment. Second, we did policy development. Now assurance mean now we are going to find out all the resources, financial resources, manpowers, instrumental resources, all that resources. We will discuss, we will analyze, we will try to collect in this insurance. So these are the core functions through which performance management can directly analyze. Second, we have essential public health services. What is essential public health services? Mean we are going to find out public need, try to diagnose, try to investigate, and then treatment. So what they do? In essential public health services, the workers or the policy developer or policymaker, they always try to communicate with the community, with the targeted population. They're trying to monitor the health needs. Trying to monitor the health needs. Next, when they monitor the health need, they try to investigate, they try to diagnose and investigate the health problems and the causes of health problems. Next, they always try to educate community or a targeted population about the health needs. about the hygiene, education about health. Next, in public health, they're trying to implement, but they're trying to develop a plan through which they can help the community peoples. More, they they developed rule and regulation for the community safety, the personal safety and the health safety. For example, like government have different rules. No smoking zones. We have no smoking zones. It's the safety of human beings, because we know that we have active smoker, we have passive smokers. The passive smoker who is not actually smoking, but when someone is smoking, they are inhaling that smoke. So if passive active smoker have 80% lung damage, then passive smoker has 40% of lung damage. So government have rules about the smoking, like people can't smoke in a public area. It's a punishment. Safety rule for driving, there is age mentioned, that after that age you can have driving license. Safety norms. So this is how they do in public, essential public health services. So performance management, they can check the performance through public health service, essential public health services, whether they are doing their job or not, or they are doing the job properly or not. Assessment, performance assessment. Third, we have the healthy people, 2000s. This is the third pillar, and the function is same like other two. There is a group of people, they create a group, they call healthy people group. What they do, they always promote health education in the society. They always try to educate people about the health. They always trying to find out the health status of the people. They always trying to explain the society about social factors which directly influence a health status, or negative social factors. They're trying to minimize that negative social factors. So these are the three pillars through which health performance management analyze the performance of the health worker. So thank you so much, students. So far so good. And this is all about how health performance management apply in public health through these three what we call platform. So thank you so much, students. Take care. I will see you again with another topic.